Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Have you ever thought of a disease that quietly attacks one of your body's most vital organ and also often goes without a single symptom until the damage is already done? Hepatitis, inflammation of the liver, is often called the silent invader. Affecting more than 300 million people worldwide, hepatitis comes in many forms, from short-lived to life-threatening. In spite of its severity, many don't even know they have it. Today in Wellness Watch, we discuss hepatitis and its prevention. I'm Preeti Kaur. So through the show, we will talk about hepatitis today. Here's the thing, it's a liver infection that can be serious. But do you know the difference between hepatitis A, B, C, D and E? How do you protect yourself from contaminated food and water or infected bodily fluids? Can you spot the symptoms? We'll break it down for you. Causes, risks, prevention and treatment. What if you could prevent liver damage? Let's explore the facts and also get the answers you need to take control of your liver health. Let's take a look at this report from Sujata Lochab.
Did you know that over 325 million people worldwide are living with viral hepatitis? That's a staggering number. Yet, hepatitis remains one of the most misunderstood and underreported health issues globally. Let's talk about hepatitis, what it is, how it affects millions, and most importantly, how to protect yourself. Here's the thing. Hepatitis is inflammation of the liver. Yes, it's that simple. But what's not simple is how it can affect your life. Let's break it down. There are 5 main types of hepatitis. Hepatitis A, hepatitis B, hepatitis C, hepatitis D, also known as Delta variant, and hepatitis E. Now here's what you need to know about each type. Hepatitis A or HAV is primarily spread through contaminated food and water, is often associated with poor sanitation. The good news, it's usually a short-term infection and there's a vaccine available. Hepatitis B, HBV, can be acute or chronic. It spreads through contact with infectious body fluids like blood or semen. This can happen through unprotected sex, sharing needles, or from mother to child during childbirth. Chronic hepatitis B can lead to severe liver damage, but there's a vaccine and antiviral treatments that can help manage it. Some people recover, while others may need treatment. Chronic hepatitis B affects over 290 million people worldwide, according to the WHO. Hepatitis C, HCV, is primarily transmitted through blood. Think sharing needles or receiving contaminated blood products. While there's no vaccine for hepatitis C, there are effective antiviral treatments that can cure the infection in most cases. Hepatitis D, HDV or Delta variant is unique because it only occurs in those infected with hepatitis B. It can worsen the severity of hepatitis B and complicate treatment. HDV is considered a severe form of hepatitis with a higher risk of liver failure or liver cancer. Hepatitis E, HEV, is similar to hepatitis A in that it's transmitted through contaminated water. It's usually acute and self-limiting, but it can be severe in pregnant women. According to research, HEV is a significant public health concern in developing countries. So how can you protect yourself? Prevention is the key. Here's what you can do. Vaccines are available for hepatitis A and B. Practice safe sex. Use clean needles. Avoid sharing personal items like toothbrushes or razors. Wash your hands frequently. For hepatitis C, screening is vital, especially if you have been at risk. What if you're already infected? Don't worry, there are treatments available. For hepatitis A, rest and hydration are usually all that's needed. Hepatitis B can be managed with antiviral medications, while hepatitis C has seen remarkable advancements in treatment with new drugs that can cure the infection in as little as 8 to 12 weeks. In some cases, liver transplants may be necessary. The good news is that hepatitis is preventable and treatable. By understanding the risks and taking steps to protect yourself, you can reduce your chances of getting infected. So what can you do today? Get informed, get vaccinated, and practice safe habits. Your liver will thank you. Research shows that early detection and treatment can significantly improve outcomes for people with hepatitis. Sujata Lochap for DD India.
According to the World Health Organization, chronic viral hepatitis causes 1.3 million deaths annually, with hepatitis B and C being the silent primary drivers of liver cancer and cirrhosis, despite them being preventable, treatable, and also, in the case of hepatitis C, curable. In India, 40 million people are chronically infected with hepatitis B and 6 to 12 million with hepatitis C. World Hepatitis Day is observed each year on 28th of July to raise awareness of viral hepatitis and the inflammation of the liver that causes severe liver diseases and liver cancer. The theme for this year, Hepatitis, Let's Break It Down, calls for urgent action to dismantle the financial, social and systemic barriers, including the stigma that stands in the way of hepatitis elimination and liver cancer prevention. Today in Wellness Watch, we look for these answers. What is hepatitis? What are the causes and symptoms of hepatitis? What are the complications if it is left untreated? We'll also discuss what preventive measures have to be taken and what medical advancements have been made in India. The main idea of the show is to showcase India as a medical hub. And every week we pick up a disease and we tell you about the special hospitals in the country that deal with that disease and help spread more awareness. When we talk of India and hepatitis, then the government of India is implementing the National Viral Hepatitis Control Program, that is NVHCP, since 2018 under the aegis of National Health Mission. And it offers diagnostic and treatment services for hepatitis C, A and E. The scope of the program was expanded to include diagnosis and management of hepatitis B in 2019. Up on your screens, we will now have hospitals and institutes that specially cater to this. Institute of Liver and Biliary Sciences, New Delhi. All India Institute of Medical Sciences, New Delhi. Postgraduate Institute of Medical Education and Research, PGI-MER, Chandigarh. King George Hospital, Visakhapatnam, Andhra Pradesh. To help us understand the severity of hepatitis and to what extent it can affect our lives, we're joined in by guests. We're joined in by Dr. Sagnik Biswas, Assistant Professor, Department of Gastroenterology, AIIMS, New Delhi. And virtually, Dr. Ashok Chaudhary, Additional Professor, Institute of Liver and Biliary Sciences, that is ILBS, is joining us. Thank you so much, both of you, for joining us on Wellness Watch today. To begin with, Dr. Chaudhary, I would want you to explain to our viewers, in simple terms, though we did show a detailed report, what is hepatitis and how does a person get affected by it?
Yeah, so hepatitis is, the term suggests, is a swelling in the liver. The liver get injured either with silent or being with symptoms. So there is two ways they present. One is acute, that means suddenly the liver get illness. In terms of you are having jaundice, you are having pain abdomen, you have decrease in appetite, you are feeling weak. So this is happens often because of hepatitis A and hepatitis E. So that's we call it as acute hepatitis. And this acute hepatitis has two ways. Mostly they are self-limiting and get controlled with medical measures. But only one problem with this, that those are high risk groups, those having comorbidity disease, those having immunity is low, pregnant women, they get problems called as acute liver failure, which is a life-threatening medical condition where the people in 60% may not survive or they have to go for the urgent liver transplant. That is because of acute liver failure, hepatitis A. So, and hepatitis E. Then second comes to the silent or the chronic components, that is hepatitis B and hepatitis C. So hepatitis B is a major problem in India or the developing countries, where it is mostly go from mother to baby. So the disease of a baby is because of his no cause. It is hepatitis B transmitted from mother to baby when we are not able to diagnose this hepatitis B in mother, or we are not doing routine screening. And if you screen them, the babies should be given a vaccination at birth, so hepatitis can be prevented. If not, then they develop liver disease, liver cirrhosis and liver cancer at a very young age or in the long standing. Then hepatitis C is a disease which is also similar way. They get transmitted through the blood products and needles, syringes, tattoos, and that causes also chronic liver disease. So dear friends, hepatitis B and hepatitis C, we need three things. You have to be aware of these symptoms. If it's no symptoms, but only thing you can do is get tested, get treated, get vaccinated. That means if hepatitis is to be tested for everyone, including me and all the viewers and the audience and across the India, then we should get vaccination to everyone. For a baby at birth, please all parents, whoever listening this, ensure that in your circle, in your family, the baby should get a vaccination. It is only 3 doses for life, 0, 1 and 6 months. And that is a big boost for this hepatitis to be prevented. And that is hepatitis B is only disease which can be prevented. It is the only liver cancer that can be prevented. And then we have to test hepatitis very often. Then, and that is for the chronic hepatitis. For the acute, we have vaccinations. We request every parents to get hepatitis A vaccination, which is now available. It is 2 doses, 0 and 6 months, to give your parent children after 1 year of age. And for
Right.
hepatitis E, there is no vaccination, but clean hand, clean water, and a clean food. This is the best treatment for hepatitis A and E, water-related diseases, to be prevented.
All right, the very first question, the very onset of the show, the doctor has explained to us in detail what is hepatitis. But Dr. Biswas, or for that matter, I would want you to take that forward, what Dr. Chaudhary has said, and tell us which is the most severe form of hepatitis, one. And second, he did spell out the difference between chronic and acute hepatitis. Is it that a person would begin by getting, acute hepatitis, which eventually can it turn into chronic hepatitis?
Right. So, first of all, good morning to everybody who is watching this show. With regards to what Sir has already told us about hepatitis, there are two kinds. It can present acutely or chronically. The main thing is that in acute hepatitis, the patient becomes symptomatic. He starts developing symptoms of disease in the early stages, particularly with hepatitis A and E. We find that there is an unwillingness to eat, they're unable to keep down their food, their appetite becomes low, some of them have a bit of discomfort in the right upper part of their abdomen. And this gradually progresses to, might progress to a stage where patients may become jaundiced. And at that point of time, if we do a blood test, if we do liver function tests, which are commonly performed, we find that the liver enzymes, SGOT, SGPT, are markedly elevated in patients with viral hepatitis. In some patients, particularly with hepatitis A, E, and hepatitis B, the acute phase can progress to a phase of liver failure, which can go to acute liver failure, although this is much more common with A and E rather than B. Now, which patient will progress to this very severe phase, which is what we are all afraid of, because for A and E, there is no definitive treatment. We provide supportive care for patients who are not responding. They may even require a liver transplant. Some factors are well known. Patients who are old aged, who have multiple comorbidities like diabetes, who may have malignancies, other cancers, or other diseases which affect the immune system, they are more prone to progressing. However, this is not definite, and for an individual patient, it's very difficult to predict. For hepatitis B and C, these are more commonly seen as chronic. Particularly in India, you would see more chronic forms. In hepatitis B, having childhood jaundice is very common. These patients often tell us that we had episodes of jaundice as a child, which may have gotten better on its own, so we really didn't pay much attention. And right now, I've had a test done, and I find that my liver enzymes are deranged. And since these are chronic, you can consider that they've been with you for a very long time. So they've been silently hurting your liver all this while. So having cancers in the liver, like hepatocellular cancer with hepatitis B, particularly hepatitis C, is very common, and we still see these patients despite effective treatments being available. Cirrhosis is the pre-stage. It is the stage which comes before cancer, but now we're even seeing HCCs in patients who don't have underlying liver cirrhosis, just chronic liver disease.
All right. Dr. Chaudhary, Dr. Biswas put forth for us the symptoms. But then is it so that at the very onset of a person getting hepatitis infection, will the person immediately witness the symptoms? For how long can the symptoms be silent? And when is it the time for a person to see the doctor?
Yeah. So basically, first of all, these symptoms is two ways, one acute and chronic. As rightly said, if acute means particularly the seasonal. Now is a epidemic of hepatitis A and E is going on. You can see in a group space, rainy season, you get fever, then you have decrease in appetite. And simplest way, you just see that you are having a yellow, yeah, you can say mustard color like urine is coming up. If someone notices that your eye is yellow, that means you have the symptoms. You have to repeat immediately to a nearby doctor and get tested done. So with this, what can happen? Though hepatitis A or E being acute, they may not have a very severe course, but the course is unpredictable. Hence, being under supervision of a doctor, guided by the treatment and follow-up, will make helps. And hepatitis of A and E, these acute episodes usually get subsided in 2 to 3 weeks. But this once the fever is subsided, once the jaundice is settled in, and then your appetite returns, that means things are going to improve. Only one thing happens, they may develop severe itching because of this jaundice, but that happens at a later on. So it is the hepatitis most important in acute condition is that whether you are having jaundice which is progressively rising, whether you are having little bit of behavioral abnormalities, or your blood parameter shows some alarming symptoms, like one blood parameter we call as INRPT, which becomes more than 1.5. So these are the conditions which becomes a medical emergency, you have to report. But at the same time, chronic is more problematic, because chronic means they are already affected by the hepatitis, because in acute, nearly 90% get cured and 5 to 7% need treatment, only 1 to 2% become seriously. But in hepatitis chronic, all are patients. So what you have to do, if anyone is the family having a liver disease, anyone having a jaundice, or in your family anyone having a cancer problems, so you have to think that is a red button, get a tested hepatitis B and hepatitis C. If you are having some chronic diseases, most often they are getting tested. So that is one of the things. Like some corporate employees or government officers, they are going for the hepatitis testing as a routine health checkup panels. And I request everyone to have a screening for hepatitis, a simple test with the kits only, that get easily done. So if you are able to do, then we can able to detect it before the symptoms happen. So that is why hepatitis B in a normal general population, two ways: either you becomes a high risk person, that is your family history, you are having alcohol, you are having tattoo abuser, you are having IV drug abusers, having multiple sexual partner and having unprotected sexual intercourse, then they should get checked for this hepatitis. And that is most important for the chronic in a general population. And if you think of a disease person, that means you're having any chronic disease like diabetes, kidney problems, you are on dialysis, you are a cancer patient, you are getting chemotherapy, it is mandatory that we should have to get tested before the symptoms happen.
Right. So screening is the crux. All right. Dr. Biswas, if a person gets, any kind of hepatitis virus through his lifetime, and after treatment, after cure, can the hepatitis reoccur? One. And secondly, if a person is affected by a particular virus of the hepatitis, is there more chance of him getting more, prone to other viruses of hepatitis at the same time?
Right. So for hepatitis A, a single infection is traditionally considered to confer lifelong immunity, and it is unlikely that the patient would have a recurrence, although we are seeing, with time, we are seeing these patients come back. Some of them do come back with recurrent episodes. In terms of hepatitis B and C, these are chronic infections, so they really don't give you, lifelong immunity, and you will continue to have these infections. With regards to co-infections with other viruses, this is traditionally seen with the HIV virus, where HIV is known to coexist with hepatitis B and C, but that is more because the route of transmission is similar, like needle sharing and drug use. It is not really that the presence of one virus would increase the chances of you getting another viral illness. It's usually seen in patients who have some kind of immune deficiency deficiency or weakness of their immune system.
Is there any age group which is more prone to hepatitis? Do children also get hepatitis?
Absolutely. In earlier times, it used to be considered a disease of childhood, hepatitis A, because it's predominantly spread through food and water. So you see this, used to see this predominantly in school-going children who would, have food from outside sources where the contamination of food cannot be controlled. However, with with time, we've seen that it's now becoming more common in adolescents and elderly, where the disease is having a more severe course than you would expect to see in children, right? So which actually calls for expanding the age group for the vaccination program and vaccinating adults as well, even adolescents along with children.
Right. Dr. Chaudhary, we did talk of hepatitis screening, we did talk of hepatitis, diagnosis, but if a person gets hepatitis and he is cured, to what extent will it, will this infection, in spite of having been cured, will it have a bearing on the liver health in the long term of the person?
Yeah. So one more important thing, whenever you get a hepatitis A or E, then you get naturally vaccination, because vaccine is a virus which has become less powerful. So once you get a hepatitis A or E, then no need of vaccinations. As rightly said by Dr. Biswas, hepatitis A or E you get naturally exposed. So in adults, mostly we have a protection. So they say in childhood gets vaccinations. But what happens to the hepatitis B and C when they are not getting vaccinated? They are at the risk of getting this disease, but hepatitis C there is no vaccines, and but hepatitis B vaccine is available. In that way, we can able to get these things controlled. And then second, the recurrence of hepatitis is uncommon because hepatitis A and E get protections, and hepatitis C has a chance to get, and hepatitis B remain always with us. So that's why hepatitis B and C, once it is happened, C get cured, but chance of getting again is two ways. Either the virus become reactivated again or get some another source of like those having dialysis or any surgeries, they may get. But B, it is always, once it is infected, it remains in 96%, only 4% get cured. So it remains with this. So in hepatitis B, there is no question of having second infections, but it is the treatment defaulter, or you are not able to follow the medications, then you having the symptoms get aggravated, you get problems because of the hepatitis B virus coming up again.
Right. Also, acquaint our viewers with what R&D is being done in this field, what medical advancements have been made in India, particularly when we talk of hepatitis. Dr. Chaudhary first.
Yeah. You can think of innovation is first of all hepatitis A vaccine, which has now come up to India. We have got a rigorous clinical trials and become effective. So now this hepatitis A vaccines we can give, and this is after age of 1 year. It is safe and is effective up to 95%, and the protection remains for 20 years. So that is one good thing, hepatitis A vaccines, which has been tried in India multi-center, and the results has been published, and we can get vaccines for the hepatitis A. And hepatitis E vaccines now is coming up in the trial mode, hopefully to come soon. So there are two new things. And if you think of hepatitis C, the drugs has really making wonder. So now we are getting hepatitis C, target of getting eliminated from India by 2030. That is the target. And for the hepatitis B, and most important, we are able to cover in India the way hepatitis screening. You can say this is called as missing the millions, because hepatitis B happens because we miss them for early diagnosis.
Right.
Hence, screening test has now become aggravated, made escalated, and I can show there is a dry blood spot. That means many people are not coming for the hepatitis B testing, but what you do, in a blotting paper, you collect the blood, you make the parcel, you send to ILBS or some other centers are existing. From the dry blood, we can make the hepatitis B testing. So that is a breakthrough where you can get hepatitis B screening for the remote people who are not willing to come to a hospital. And now this hepatitis B screening has been adopted in multiple health programs as a national health program. So screening is the most innovation what India has started. Then compulsory vaccination for the children at birth, that is another innovations, and that is making free of cost. This Indradhanush program. So by this we have made both two ways. One is medical research, one is in the medical public health.
Right.
So this
Right. I'll take that forward to Dr. Biswas. You would add to it?
Right. So I think, as Sir has pointed out, a lot of legislative changes have happened which are very positive and focused towards preventing the disease in public, because effectively hepatitis is a preventable disease. All of these can be prevented. I would just like to add on that in addition to these changes on the treatment front, there have been a lot of advances in liver transplantation in India. We've gone ahead with live donor as well as deceased donor liver transplants, which are available more for patients who have acute liver failure and end-stage liver disease and are suffering from this. In addition to that, several other newer devices like plasma exchange and these therapies are coming up for patients who are waiting for a liver or cannot get the liver transplant. So both from the diagnostic as well as from the therapeutic viewpoint.
We will also have a quick Mythbuster round for our viewers to get some myth of theirs busted. I'll request both of our guests to give very crisp answers. Dr. Chaudhary, all types of hepatitis are equally serious or fatal. Is it so?
No, it is hepatitis B, C are more fatal.
Hepatitis is genetic, that is, it is passed on from parent to child always. Dr. Biswas.
Not really genetic, but yes, hepatitis B is passed from the mother to the fetus, but it is not genetic.
Hepatitis C goes away without treatment. Dr. Chaudhary.
Yeah, only 15% goes away. In 85% is treatment, but treatment is very short lasting.
Dr. Biswas, bland food and boiled vegetables are the right kind of foods for preventing hepatitis?
Absolutely no. High protein diet is advised so that the patient does not develop weakness during the course of illness.
Dr. Chaudhary, hepatitis B spreads by touching, coughing and sharing utensils.
No, it is only through the blood, air, body fluid contamination.
And Dr. Biswas, hepatitis and jaundice are synonymous, are the same?
Not really. There are multiple causes of jaundice other than hepatitis, although it is the most common in India.
All right, with that, we end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch and helping our viewers understand hepatitis and its threat, its severity better. So after this wholesome discussion, we did know that hepatitis is both curable and preventable, and the tools to eliminate hepatitis already exist. The gap lies in access, awareness and early diagnosis. With collaboration and awareness, this tide can be turned against this silent epidemic. Remember, we have got one life and we have got one liver. Hepatitis can devastate both. Ending hepatitis is not just a medical goal, it is a moral imperative. With that, we end this edition of Wellness Watch here. Till we meet next, take good care of yourselves.